Hi, my name is Phil. I like talking about politics, and in this video I'd like to discuss the government's failure to support our healthcare system and how that could mean that a mass vaccination programme for COVID could be delayed by up to 2 years beyond the time still needed to actually develop the vaccine itself and give it the green light. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, I think I need to take something back, it seems, because as I've been discussing one Boris Johnson inspired disaster after another regarding our COVID response, along with every other response, one of the areas I've said the government actually seemed to be getting it right was in the pursuit of a vaccine. I suppose I should have known better, because reports now suggest that even if a suitable vaccine becomes available in the next few months, and the government have been backing a couple of horses to try and get early supplies if they come up trumps, that we still won't be able to use that vaccine en masse around the country. And the reason is that the government are failing to procure the supplies needed to store and transport the vaccine in the amounts needed. You know, we aren't acquiring enough medical grade glass vials or refrigerated lorries and other aspects of the transport and distribution network needed. According to a report in the Mirror, but there's been reports in a few places here, we're also falling behind with stocks of pallets and PPE as well, which would also be needed. And I guess I should have seen it coming. To be fair, I should have seen it coming. After all, we know that the government do not procure medical supplies in the normal way. You know, like buying them from people that make them. No, that would be ridiculous. Why would we do that? That would be silly. No, what they do instead is they pay vastly inflated sums to companies that have nothing whatsoever to do with medical procurement. Sometimes even companies that don't actually exist or employ any staff. No staff at all on their books, some of these companies. So why on earth did I suppose that the government would actually prepare for rolling out a COVID vaccine? And I suppose it's because the government have pinned all their hopes on the vaccine. This is the thing I thought, yeah, this is because they know they need this. They've completely given up trying to control the virus. The average number of new cases in the UK right now in our second wave exceeds the peak of our first wave. So now this second wave is already, in terms of number of cases, in terms of its, spread, worse than the first wave. And, we don't know how long this wave will last. We know that the last one remained for quite some time. If you look at other comparable countries, not so much the US, but in Europe, let's say, it tended to get to a peak and then it came down. In the UK, this did not happen. It came to a peak and then it sort of stayed there for a while and then came down because it was too protracted, because we didn't take the right measures, or we didn't take the right measures early enough. And the second wave may well be much worse. It may be more protracted. But we don't know. We don't know that yet. We do not know. But what we do know is that the government are not being serious about adopting the measures advised by medical and scientific experts. For example, medical and scientific experts said you're going to need a 2-week national lockdown again. You've asked about, now we need this thing. What does Boris Johnson do? He says, okay, I'll tell you what we'll do. We'll close pubs and restaurants at 10 p.m. That has backfired massively. Now the government are talking about maybe closing bars and restaurants completely, okay, but only in parts of the north of England and in London. Oh, right, you mean in Labour-held areas then? I see. Okay, all right then. We also know that the test and trace approach is fundamentally flawed. Having the system run by private companies and directors with no background in public health at all was never going to work for such a complex task. And it has no chance of getting up to speed because we have got the wrong people in charge of it. The government will know this too. They won't back down and give the job of test and trace entirely to the NHS as they should, because not only will that be the mother of all U-turns and make them look ridiculous, but COVID for them is not an emergency to be dealt with. It's an opportunity to raid the country's wealth for themselves. You know, they also won't start following the medical and scientific advice. They will constantly seek to water it down. It'll be like, it's almost like they think it's a negotiation. It's almost like the government, when discussing with their scientific and medical advisors, think it's a negotiation. Oh, you're proposing this. Well, I'll tell you what, we'll do this instead. That's a compromise. What they're proposing is what's necessary. You know, but the fact of the matter is that Conservative MPs, this isn't just about Boris Johnson, Conservative MPs, both inside and outside Cabinet, as well as the right-wing media, will simply not support it. Boris Johnson's position now as leader is too weak to actually make any tough decisions. He cannot really go against his own party now. And against this background, a suitable vaccine was their only hope. This is why I believed that the government would actually take that aspect of the measures seriously. Because surely what the government absolutely cannot afford to happen is for other countries to roll a vaccine out. Slip into some sort of acceptable normality of life. I don't necessarily expect other countries anytime soon to go back to what we considered normal. But getting into a tolerable cycle of life, get their economy firing on all cylinders again, while we are still a plague island, run by lunatics, enduring wave after wave, potentially, of the pandemic, along with the economic shocks from both COVID and Brexit hammering our output as well. You know, the CEO of a company that's going to be involved in the delivery of the Oxford vaccine, should that succeed, and that's what we think is our best prospect at the moment, they were telling the Mirror that we're simply not ready to deliver the vaccine quickly. And it was also reported that some other countries are hoarding some of these supplies for that purpose. So again, we're going to be behind. I mean, I should have seen it coming, shouldn't I? Shouldn't I? I mean, despite having more warning than most of our European neighbours, we were blasé about procuring necessary supplies for the first wave. And we also know that our government is not really one that learns lessons. After all, we said that we were going to avoid the first wave. We were going to avoid COVID. We were going to get away with it. Then we didn't. Then, just before the second wave was undeniable, our own health secretary saying, yeah, we're going to avoid the second wave. What we've put in place is absolutely fine for it. It was literally 3 days later when he had to say, oh, by the way, we're in the middle of a second wave now. Well, not the middle, at the start of a second wave. But it was now undeniable. It was inevitable when he said we were going to avoid it. You know, and then you try and think this through. So what is being reported here is that so we might not get sufficient levels of vaccination in this country to achieve genuine herd immunity until 2023. That's what they're saying. Now imagine that. Imagine trying to live with this the way we are doing at the moment for another 2.5 years, maybe. 2.5 years. The idea of herd immunity without a vaccine is completely discredited now. I mean, it was before, but too many people in society were considering it. And this is despite the fact that the government pursued this concept. Only a small percentage of the population are believed to have antibodies. All the press that tried to push this idea kept saying, oh, we already reckon about 60% of the population have got antibodies. No, it's a tenth of that. It's about 6%. About 6%. When we've let the thing run rampant through the country. And, you know, even the vaccine, when it becomes available, and I'd like to say when, not if, when it becomes available and can be distributed, because that now seems to be a problem, is likely to need retweaking and resupplying on a regular basis. You know, it's not just like, you know, you get your shot and you're good for life. That's not how it's going to work. So let's just recap where we are then. So one, we have a government whose support base is against restrictions, even ones as simple and benign as wearing a piece of cloth across your face. They won't even have that. Even if it means they can do what they want, they won't even wear the mask. Two, we did not have the NHS capacity to deal with the first wave. We only made it look like we did by passing the problem onto care homes, and we saw how destructive that was. So we certainly do not have the capacity to deal with a second wave plus seasonal flu, which again means care homes are going to be sacrificed. Three, when the government do get behind certain restrictions, many people are now less likely to follow the guidance. In fact, we've seen this. due to the loss of credibility over those close to the Prime Minister ignoring the rules themselves without punishment. 4, we do not have the test, trace and isolate programme to manage the pandemic without significant restrictions. In fact, not a single part of the programme is working. So it's not like, we've had scientific experts saying, well, if one part of the programme was punching above its weight, it could pick up the slack in a weaker part of the other. None of it is working. The testing is not working. The tracing is not working. And the isolate strategy is not working. All of it is subpar. None of it can afford to pick up the slack from other parts because it can't even pull its own weight. 5, the best plan Boris Johnson has right now to deal with the virus is getting police to knock on doors and carry out spot checks on the rule of 6. As if we have anywhere near enough police to make an impression with that nonsense. And also, how's that even supposed to work? If you actually had more than 6 people who didn't live in your household in your house when the police came knocking, are you going to say, certainly officers, come right in and have a check and get a £10,000 fine? No, you'll say, sorry, we don't really need any more people in here. Thank you very much. Good night. Because they can't force their way in without a warrant. Absolutely ridiculous. Yeah, there are, as I say, talks about closing pubs and restaurants down properly, but only in some Labour-held areas. And even that will face significant opposition amongst his fellow Conservatives. 6, we are headed for a hard Brexit that is going to make it even more difficult to manage a serious healthcare crisis unless something changes drastically over the next week or so. And 7, now the one thing that I thought the government would actually be taking seriously, the pursuit of a vaccine, is being knackered by a lack of preparation for storage and distribution. So it's like Boris Johnson has gone, well, I've done my bit with the vaccine because I'm investing in this and I'm ordering all these shots without any thought whatsoever for how he's going to get those shots around the country. And it's not even like getting rid of Boris Johnson would make the situation better, because none of his likely successors, that is Rishi Sunak or Michael Gove, have the slightest inclination towards a better handle on the situation. If anything, their attitude is even worse than Boris Johnson's. But anyway, those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.